Hello again. I'm going to pick up here with talking about the therapeutic process as it relates to reality therapy. If you haven't already watched the philosophy and basic assumptions of reality therapy video, I recommend you start with that and then come back here. All right, let's go on. Assessment. So, according to reality therapy, clients should not be labeled with a diagnosis except when necessary for insurance purposes. This is because the symptoms that clients experience are considered descriptions of behaviors that clients are engaging in order to deal with unsatisfying relationships or to meet basic needs. Labeling these ineffective behaviors as mental illness in this case is inaccurate. Instead, the focus of assessment is looking for key unsatisfying relationships, usually a relationship with a spouse, client, parent, or employer. A total behavior assessment can also be helpful in order to identify the specific ineffective behaviors that the client is bringing to therapy and to start to explore what unmet need or unsatisfying relationship they may be attempting to address. So you can see there are some questions here that can guide that assessment process. For example, what message are others getting from this behavior, whether or not you intend to send it to them? The role of the therapist in this case is to develop a satisfying relationship with the client, and this is a prerequisite for effective therapy. This relationship can be developed with things like active listening, suspending judgment, using humor appropriately, being oneself, engaging in facilitative self-disclosure, and so on. A lot of these are basic therapy skills that you learn anyway. But without this relationship, therapy will not work according to reality therapy. It's important to note, however, that this doesn't mean that the relationship alone will be automatically curative or healing, unlike some psychodynamic approaches may suggest. Instead, once the relationship is developed, the skill of the therapist as listener and teacher assumes a central role. The therapist will begin to teach the client how to engage in self-evaluation, which is done by raising the question, is what you're choosing to do getting you what you want and what you need? Similar to CBT, the role of the therapist is not to make an evaluation for the client, but rather to challenge the clients to examine what they're doing, decide what they want to change, and make a plan to make those changes happen. The therapist will then act as a mentor who guides the client towards satisfying relationships, teaches the client more effective social skills, and helps them figure out how to get their needs met. Finally, the therapist is there to instill hope that no matter how bad the client feels, change is possible. Okay, now when conceptualizing symptoms, reality therapists believe that the underlying problem for most clients is that they're either one, involved in a present unsatisfying relationship, or two, they lack what could even be called a relationship. So many client problems are caused by a client's inability to connect, to get close to others, or to have a satisfying or successful relationship with at least one person in their life. Due to lack of awareness about this, though, clients choose certain behaviors as a way to deal with the frustrations caused by unsatisfying relationships. Unfortunately, many of these behaviors are ineffective and only intensify the issue. If you think back to the first video where I talked about someone who tries to seek out pity from people as a means of connecting, this is likely going to backfire and make things worse. Again, remember that symptoms are a sign that the behavior the client is choosing is not satisfying their basic needs. So let's look at a visual example here. In this example, the behavior that the client may be presenting with is oppositional behaviors, which we would normally classify as a symptom, but in reality therapy, we're looking at it as a choice, as a behavior that's being utilized in an attempt to meet a need, but it's ineffective. The client in this case may also be engaging in maladaptive coping, like risk-taking behaviors, so things like rebellion or challenging authority. Our work therapeutically would then guide the client in figuring out which need they're trying to meet. In this case, a potential unmet need is freedom, and the client is attempting to experience some sense of control through the maladaptive behaviors and the risk-taking. You can see that these behaviors would likely be ineffective if the person is engaging in rebellious behaviors and opposition. They're likely going to get their freedoms even more restricted, especially if we're talking a child or an adolescent here. So the goals of therapy would then be to help the client identify unmet needs. So in the case of the example I just shared, that need for freedom and control, and attempt to satisfy them in an appropriate and effective manner, which doesn't include rebellion or opposition. So basically helping them to learn better ways of fulfilling all of their needs. Remember, the needs are love and belonging, achievement, power, freedom, and fun. So this involves helping clients make more effective and responsible choices as they relate to their wants and needs. So a way to experience freedom, for example, would be to show that they can be trusted with more responsibilities, to meet expectations, to maybe help out around the house more, things like that. Okay. Another goal would be to get connected or reconnected with people that they've chosen to put in their quality world. And this would help to fulfill the need for love and belonging, which, remember, is the most primary need according to reality therapy. Now we'll move into some specific techniques and interventions that could be used in reality therapy to help the client meet their goals. In the process itself of reality therapy is broken into two components. The first is creating the counseling environment. I won't go over this too much because I covered it when I discussed the role of the therapist section, but really briefly, a supportive and challenging environment allows the client to begin making life changes. So you want to avoid arguing, attacking, demeaning, or criticizing the client. And you want to take a stance that is mildly confrontive, but always caring. And this is going to allow a foundation to be built where we can move into component 2, which has to do with implementing behavior change interventions. Now, we want to try to weave these two components together in a way that helps clients to evaluate their lives and decide to move toward more effective behavior. So let's look at some specific behavior change interventions. First, we have the WDEP system. So this stands for exploring wants, possible things the client can do, opportunities for self-evaluation, and designing plans for improvement. Each of these letters obviously stands for something, and they also stand for a cluster of strategies that I'll be going over next. So first, W, the wants. The question here is, what do you want? This is an exploration of wants, needs, and perceptions that is accomplished through skillful questioning. We're helping clients to move from a sense of external control to a sense of internal control. This also involves defining what the client wants for therapy and the world around them. We might do this by exploring the picture album or quality world of the client and examining how their behavior is aimed at moving their perception of the external world. D has to do with what the client is doing. So the question is, what are you doing? And will this choice get you where you want to go? This is about helping clients make more need-satisfying choices. Some questions we would ask would be, what are you doing now? What did you want to do differently this past week? What stopped you from doing what you said you wanted to do? And what will you do tomorrow? Next is self-evaluation. And the question here is, does your present behavior have a reasonable chance of getting you what you want now? And will it take you in the direction you want to go? Here we're examining behavioral direction, specific actions, wants, new directions, and plans through skillful questioning. So for example, is your current behavior bringing you closer to people that are important to you or driving you further apart? Remember that individuals will not change until they first decide that a change would be more advantageous. So this process of evaluation of behavior is ultimately the responsibility of the client, but we can be more directive with questioning at first in order to help to scaffold the client so they're able to do the evaluation themselves later. Next is planning and action, the question being, what is your plan? And this involves helping the client identify specific ways to fulfill their wants and their needs. This process of creating and carrying out plans enables clients to begin to gain effective control over their lives. If the plan that is developed doesn't work, the therapist and the client then work together to come up with a different plan and try that one out. We are continuously urging the client to be willing to accept the consequences for their own actions and choices in this process. Okay, next we have SAMIC. And this involves having simple, attainable, measurable, immediate, involved, and controlled, committed, and consistently done plans for change. These plans that are developed should not depend on other people, and they should be performed daily and carried out as soon as possible. So we could get to this by asking a question like, what are you willing to do today to help begin to change your life? In order to help increase the commitment, it's best to put it in writing, okay? So to break these down just a little bit further, this is basically describing the type of plans that should be developed. We want them to be simple, meaning that the client is able to understand the plan very easily, and they're able to track accurately whether or not they're doing the plan because it's specific and concrete. The plan should also be attainable, and this is going to be based on the individual themselves. If a goal or a plan, might seem appropriate for you, but it seems like it's too difficult or not attainable for the client, it wouldn't be an appropriate plan for them. So you need to take into consideration their capacities and their motivation for change when developing the plan. The plan should also be measurable. If they're making certain behavioral changes, we want to make sure that we can track whether or not those changes are happening and how much they're happening. They should be immediate and involved, meaning they shouldn't be plans for 3 months down the line. This should be a plan that the client can implement as soon as they leave the therapy office. And controlled. This needs to be something the client can do on their own. It should not depend on other people because that risks failure. The client needs to be able to implement the plan on their own and be responsible for whether or not it works out. Okay, then we have evaluating commitment. So remember that a client must be motivated to change, and so it may be helpful for you to evaluate their commitment level before implementing a plan for change. If it turns out that they're at a very low level of commitment, you may need to do more work exploring their needs and assessing their problematic behaviors before you move to behavioral change. So that becomes our role in this case. Okay, so let's look at evaluating this approach here by talking about its strengths and limitations. So some strengths of reality therapy are that it's short-term, meaning the client doesn't have to be in therapy for years before they see some changes start to happen. The emphasis on self-evaluation helps to keep the client from becoming too dependent on you and helps them to start to gain insight into how their behaviors may not be helping them. And this approach also emphasizes taking responsibility for what we're doing, which can help to both reestablish hope and to keep a client from feeling as though they have no power to make changes for themselves. Some limitations: reality therapy can place a bit too much emphasis on the therapist as an expert in deciding what a client should do behaviorally, which may turn some clients off or may make the therapist miss important things. It also doesn't take the past into account. It's only looking at the present and future, meaning that if there are certain reasons why a behavior is happening because of something that happened in the past, it may be overlooked, and that may make it so that the change that is developed isn't sustainable. Okay, that is it for reality therapy. Let me know if you have any questions, and I will see you next time. Thanks, everyone.